The definition of health. Health is according to the definition of World Health Organization. It refers to the complete state of physical, mental, and normal life in a society, but also including a good mental health for a normal life as well. So, in the state of physical, mental, and social well-being, in which disease and infirmity are upset and have evolved over time in keep with the biomedical perspective. Early definition of health focus on terms of the body ability to function. Health was seen as a state of normal and in function that could be disturbed from time to time. Alright, so and the next one is about the healthcare. It is the maintenance or improvement of health via prevention, treatment, recovery, or injuries and other physical and mental impairment in people. Healthcare is divided by health professional in alliance health five. Physical and physician associates are a part of their health professional. Dentistry, pharmacy, midwifery, nursing, medicine, and optometry, audiology, physiology, therapy, physical therapy, and other health professionals are all parts of healthcare.
I will talk about equity in health financing. Households' capacity to pay. Defining capacity to pay is essential in measuring equity in healthcare financing. Theoretically, a household's capacity to pay is equal to the total resources that a household can mobilize for purchasing health services, including savings, selling assets, and borrowing from financial institutions, relatives, and friends. Practically different variables have been used as a proxy for household capacity to pay because the information required is not always available from a cross-section household survey. Gross income or net income. In the taxation literature, pre-tax gross equivalent income is used as a proxy for capacity to pay, and one is essentially interested in the move from the pre-tax to the post-tax income distribution. Taxes and Social Security contributions are regressive. It means the poor pay a higher percentage of their income than the rich, and neutral means proportional to income, or progressive means the poor pay a lower percentage of income than the rich. If they deteriorate, equity in income leave it unchanged or improve it. Analogous in most European countries, gross income has been used to examine the progressivity of healthcare payments. Healthcare payments, however, include public taxes and compulsory insurance, as well as private sources, voluntary prepayment, and out-of-pocket payments. Household income or expenditure. The choice between income and expenditure often depends on the accuracy of available data. In most OECD country. Income data often are linked to the registration system and they are more reliable than reported expenditure from a household survey. By contrast, in most developing countries where registered income data are not available, reported expenditures in household surveys are considered more reliable than report income. But also for developed countries, there is an argument to use expenditures instead of current income because expenditures are less liable to short-term fluctuations and therefore better approximate ability to pay.
I will talk about the example. First is the problematic lead medicine therapy management reduced total cost of care. This is the analysis demonstrate the unique positive impact permanent medicine therapy management program is making on the patient outcome in 6 months. Period following the permanent this program is effectively reducing the total cost of care. And second is optimizing substitute care improve early recording and outcome. The second example of the clinical quality improvement project deal with the issue well known to hospital system. Is the major driver of the mortality in the U.S. is the estimate that up to the half of the hospital. And third is boosting resilience and shared complementary key to successful reducing. This example is critical quality improvement in the healthcare. Come from the Unified Health, a healthcare system serving Louisville, Western Illinois, and Southern Wisconsin. System leader regarding the importance of reducing clinical variation and need to have strong persistent champions and robust analysis to effective support. Improvement effort, however, they also realize that without understanding organization strength and weakness relate to adoption, change, and improving outcome, they will struggle to successfully improvement in primarily that deliver the desired benefit and sustain improvement over time. And the fourth is new generation activity-based costing and faster timeless of the decision support. This example is about the health system leader recording that the common demonstration to adapting treat and sustainable to fully understanding and effectively manage cost. To assess this, they implement activity-based costing or ABC facilitated by the health catalyst cost to deliver detailed and actionable cost data across the analyzed environment and support service line reporting, contract modeling, and critical process improvement. They use that capability to effectively drive cost, serving and improve critical outcome in many of its service lines, including several service women's health. And the And the last one is the systemic data-driven approach, lower length of the stay and improve care correlation. The last one is about the hospital was faced to the declining refit due to the change of the Medicare and medical. Hospital leaders know that addition method to providing more efficient and cost-effective quality care will need to maintain long-term success, improving and regarding length of the stay, or LOS, improve financial, operational, and critical outcome by decreasing the cost of care for the patients. It can also improve outcome by minimizing the list of hospital require and addition.